Good afternoon, everyone. Thank you for joining us for Virtual Path Day, October 28th, where we're focusing on business, economics, and data analytics, and the pathway health and health administration. This session is for students who are looking to transfer to Rhode Island College after their time at CCRI, specifically in health and health administration. And with that, I'd like to turn it over to Lucy from RIC, who will introduce herself and get us started.
Thank you, Jess. All right, my name is Lucy Rios Saunders. I'm an assistant director in the Office of Undergraduate Admissions at RIC. And what I'm going to do basically for the first half of our presentation is talk about the school in general, programs that we have available, admission requirements, and then I'll turn it over to Sara, who will go into kind of the nuts and bolts about advising, courses, and more from an advising perspective. Okay. So firstly, Rhode Island College, we're in Providence, Rhode Island, the suburban section of Providence. We were established in 1854, so some time ago, but back then primarily as a school of education. So we've evolved since then. We have over 5 schools. School of Education, which is for majors from early childhood education all the way up through secondary education and everything in between, bachelor's, master's, and doctorate programs in that school. We have a hugely popular School of Nursing. The bachelor's degree will get you RN licensure, and we have had huge success as far as pass rates for our students, 100% the past couple of falls and consistently above 95%, which is leading the region. Master's programs would allow you to move on from RN licensure to areas like nurse anesthetist, nurse practitioner, acute care, so additional certifications on top of the RN licensure. And then we also have a DNP, which is a doctorate in nursing practice, which is the practical terminal degree in the field. We have a very popular School of Social Work, which has both bachelor's and master's degrees programs. Faculty of Arts and Sciences, which houses a lot of our health science related majors, things like medical lab science, our health programs like medical imaging. So we have a number of different health related programs in a cluster in the Faculty of Arts and Sciences. School of Business, which houses another health-related major, healthcare administration. That program heavily emphasizes kind of out of the classroom experience. They have a very well-established internship program, and they actually run their own internship and job fairs on top of the career and internship services available on campus through our Career Development Center. So just another layer on top of that. I just wanted to show you some of our newer facilities on campus. The top right is going to be your nursing facilities. So the School of Nursing is our on-campus facility, which has simulation centers and classrooms. The top 2 pictures are going to be our Nursing Education Center in downtown Providence. There is a shuttle that brings you back and forth, and typically students in the last couple of years in the program, when they're doing clinicals, would do most of their courses in the downtown nursing center. It is very close to the hospitals in downtown Providence, where most students would be doing their clinical work. Bottom left is going to be our School of Education. School of Education houses another one of our health-related programs called Community Health and Wellness, which I'll go into in a little bit. And then the top left are going to be your main general education buildings and arts and sciences buildings. They're right off the main quad, Craigley Hall and Gage Hall. Popular majors on campus, and a lot of these are related to the health science fields. We do have a general major in health sciences. The track is called Human Services. It's for people who are interested in the healthcare industry, but not necessarily in a certification path like nursing or medical imaging. Possible fields after graduation, things like informatics, which is health data, healthcare delivery and research, consulting, sales. So that's a general health science track. We also have under the health science degree a specialization, in medical laboratory sciences. Youth development is another newer major that we have available through the School of Education. People who are interested in education, but not at the certification public school level. So things like community centers, after school programs. You also earn a certificate in nonprofit studies with that program. One of our more popular health science related programs is medical imaging. We have a number of different tracks with that medical imaging program. Radiologic technology, which is X-ray, nuclear medicine, ultrasound, and MRI. And if you do have a certification in RT already, you can add on certification in CT, and then also RT management, which is a bachelor's degree program. Community health and promotion, which I mentioned earlier, is within the School of Education. This is a health prevention type field. So we're finding this area is growing in the area in the healthcare industry. Health prevention, bringing attention to health issues, education, and those types of things. So there's a couple of different tracks you can do with this major: public health promotion, bringing attention to various public health issues, or you can specialize in certain areas: health and aging, which is working with aging populations or issues related to aging populations, and then also women's health issues. Another relatively new major we have is in the area of wellness and exercise science. We're seeing this growing in popularity as well. So all of those certifications related to exercise science, things like personal training, strength and conditioning coaching, exercise physiology, they do generally require a bachelor's degree in exercise science, and this does fulfill the education requirement for those certifications. There is a number of hours practicing component to a lot of these certifications, and this program does include a practicum and internship experience as part of it. And then I just listed some other interesting majors at the bottom: data science, which is in our math department. We've just added a communication concentration in journalism, and then just some interesting minors, which are always a nice enhancement to most of our majors on campus: behavioral neuroscience in our psychology department, and queer studies in our gender and women's studies department. Environmental studies is another more popular major just by virtue of the area that we're in, a larger coastal community. This translates into careers such as environmental education, outdoor recreation, national parks, agriculture even. And then I also listed our 5-year master's program, so bachelor's to master's. We do have several in justice studies, healthcare administration, mathematical studies, psychology, as well as English. I did talk a little bit about real world preparation earlier. One of the things that I think is a plus for our institution is that our faculty are front and center with our students. Because we do not have teaching assistants, graduate teaching assistants, your courses are taught by faculty members. Another great thing is that faculty members are also your academic advisors. So that gives you another layer of information in planning your courses and even planning your path beyond graduation. They are experts in the field, so they can offer you information on how to set up your courses based on what you want to do with your degree, opportunities for research, internships, those types of things. So it does really benefit students to have a faculty contact that they meet with regularly within their major. Because we are a school with a smaller graduate program, undergraduate research is something that many students take advantage of. Those opportunities are available for students seeking their bachelor's degree. And again, it gives you something extra outside the classroom, something you can add to your resume, gives you experience before graduation. Study abroad and national student exchange opportunities are available on our campus. Study abroad would be outside of North America, and then national student exchange is a network of public colleges and universities within the US and Canada. You pay Rhode Island College tuition and can take 1 or 2 semesters at one of those schools within that national student exchange network. For the health science majors, those will most likely have some sort of clinical or licensure component. If they don't, they usually have an internship or a practicum component. So again, that hands-on experience is something that's stressed particularly in our health science related programs. Even within our gen ed program, general education, what we did with that is we communicated with the professional community, asking them what are skills that they look for in new employees. And they did come back with us to us with useful information, communication skills, writing in the discipline, and knowledge of a second language were some of the things that they said were very important. So that's incorporated in our general education program. So writing in the discipline, for the nursing program, there's a specific class. For sciences and things like that, you'll learn how to write a proper research proposal. So learning how to write in your area of study is super important. And then everybody that graduates from Rhode Island College has at least elementary level knowledge of a second language, which we find serves students, particularly in the healthcare field. I did want to highlight some opportunities for scholarships and academic opportunities for students. There are a number of different academic scholarships that we offer for transfer students. What I will say is that about 80% of our students receive some sort of financial aid, and for transfer students, there's more of an emphasis on need-based aid rather than academic, but we do have a number of academic scholarships available to students. I'll highlight the honors program, which is for students with at least a 3.5 GPA in college. There's two components to that. One being general education honors, which is your remaining general education classes would be taken in an honors setting, which is typically small class size between 12 and 15 students. And then the second piece is going to be departmental honors, which is working in conjunction with a faculty member in your area of study to develop a senior project or area of research, and you present that in your final year at the institution in a symposium and poster session. There's a number of other different opportunities available through the College Honors Program, different conferences you can be a part of, research opportunities, and there are some scholarships available to students in the Honors Program. If you are the child or grandchild of a proud RIC alum, we do have alumni awards available to students. So what you would do is just indicate on your application for admission that you're a child or grandchild of a RIC alum, and you'll get the appropriate information. And then presidential scholarships are available for transfer students in a limited capacity. This December 15th is actually the first year deadline. The deadline for transfer students would be February 1st. You'd have to have a completed application in by February 1st, and again, at least a 3.5 GPA to be considered for the presidential scholarship for transfers. And then finally, we do have a combination academic need-based award called the Transfer Scholar Award. That requires a minimum of a 3.25 GPA and then demonstrated financial needs. So you would have to complete the federal application for student aid, the FAFSA, to be considered for that Transfer Scholar Award. And then there's other additional scholarships available through different departments once you establish a GPA on our campus. How to apply to RIC. This information is for first year students, but I did want to highlight it just because sometimes students will come to us with one semester's worth of work or fewer than what we consider a transfer student, which is 24 credits. If you have fewer than 24 credits earned in college, that credit is still transferable. However, we would require you to submit a first year application. Fewer than 24 credits, a year's worth of college level work wouldn't be enough for us to evaluate you as a transfer student from another school. So we'd require you to submit your high school information as a part of that process. So for first year students, it's really just the common application, essay, official transcripts from your high school, a counselor recommendation, and we're being super flexible on this testing requirement, the SAT or ACT. We're finding a lot of centers are closed, and even in my experience, the testing is not always the best indicator of success in college. So by far, the primary thing that we'd look at on a first year application would be your high school record grades, GPA, and the like. Once you do have 24 credits, you are able to apply based solely on your college record. So that's a much shorter application. And when you do get into the common application, you'll see the distinction when you first sign on, the distinction between the first year application and the transfer application. If you have 24 credits earned in college, you would complete the transfer application. GPA requirement is a 2.0. And then that is really just the common application and official transcripts from your colleges. Transfer students are not required to submit an essay or recommendations. The deadline for spring is coming up. That's December 15th. And then if you're looking to apply for the fall semester and starting in September, June 1st is going to be your deadline. And I've put FAFSA deadlines here as well for you. Now, one of the things that I did want to mention is once you submit your common application, keep an eye out in your email. You will be getting login information for the Rhode Island College website. That serves several purposes. First being a way for you to check on the status of your application, so you can see if we've received your transcripts, whether your decision has gone through. Once you are accepted, you'll be able to pay your enrollment deposit through that portal. You'll also be able to check your financial aid there as well. And then once you've enrolled with us, it becomes a Rhode Island College student account. So you'll be able to do everything a RIC student can do. Register for your orientation session, check your RIC email, register for your classes. So definitely keep an eye out for that login information, as it does follow you all the way through your time here at RIC. We will be having orientation for new students. This past fall, we did do it in an online capacity. It looks like it's going that way for the spring semester. What that basically is a series of self-directed portals where you get all the basic information about starting at RIC. Make sure you're familiar with all the services that we have available. And then that's followed up by a major specific session related to your major, where you'll be advised and directed to register for your first semester classes. That concludes my piece of the presentation. Now I can turn it over to Sara, who will go through the next part, the advising piece.
Good afternoon, everyone. Thank you for joining us today. So my name is Sara Riley. I'm an academic advisor in the Office of Academic Advising at Rhode Island College, and I work primarily with transfer students, particularly transfer students from CCRI, helping with things like course selection, program selection, and just general transfer process from your institution to Rhode Island College. So what I'm going to do today is give you like a brief tour of the Rhode Island College website as far as finding out some more information about some academic programs that you may be interested in. So as Lucy mentioned, we have several health and health administration focused majors. So let me take you through a couple of different ways that you can access the information on our programs. I'm going to begin with on this gray tab here. I'll show you a couple of different links. Where do I want to begin? I'll begin here. If you click on the current students tab, the first link under academic resources is academic advising. And why I would suggest going through here is it will give you a breakdown of contact information for each program so that you can reach out directly to department chairs for more information on a program you're interested in. So this is the academic advising page for students. The list of department chairs and program directors is split up by school. So Lucy mentioned we have about 5 schools here on campus, and health and health related programs live in both arts and sciences and School of Nursing and School of Business. So they're scattered throughout. I want to highlight a couple of programs here. We'll start with, let's go with, actually they're present in all 5 colleges, aren't they? So in the communication department, you'll find the department chair's name, office location, phone number, email address, so that as you're going through this list, which is organized by school, right away you'll have the information to contact department chairs or program directors to reach out for more information. That could be a general request for, hey, what do you do with this degree? Or why should I come to RIC for your program? Or it can be a very specific question like, I've done this, this, and this at CCRI. I'm really interested in this. Do you think your program would be a good fit? Most faculty here on the campus are really transfer friendly, transfer focused, and they're always willing to have those conversations with prospective students. So in the communication department, you may not think of this necessarily in terms of health or health administration, but there's a concentration within this program in speech, language, and hearing science. So this is a little bit of an outlier. Like typically when you think communication, you think like journalism, media, public relations. Speech, language, and hearing is focusing more on like audiology. So you're thinking speech, language pathology, audiology disorders. So this is a health-focused concentration within the communication department. So you could contact the department chair for more information on this program, for instance. I want to give you a little bit of a tour of department pages, but let me do that through biology department. And the reason why I want to take you to the biology department webpage is because there's a lot of health-focused programs in this department. So each department webpage will have contact information in the top right corner. You'll see Professor Merson is the chair, but there's also a general email address for the bio department. So simply biology@ric.edu can put you in touch with any of the programs that I'm going to go briefly through today. It's also phone number, directories, and such. Each department webpage on the left-hand sidebar will have its own information, but typically what you'll find are articulations of program goals. So this is divided by major, what, particularly in biology, what's the biology major all about, right? Where can we go with this major? For each department that mentions program goals or learning outcomes, that can give you a guide for thinking about your own values and your own desired outcomes for your education. If it matches up, find out more about the program. It may be a good fit for you. Other kinds of information available on the website are things like scholarships and awards. So you'll find out all department pages will have information on available scholarships, also things like honors programs, or specifically, Lucy had mentioned about our research opportunities. So the biology department has a thriving research, numerous thriving research labs for undergraduates to join. So you'll find out all of the different kinds of labs that are available in biology. Okay. And also different kinds of careers. Okay. Now these pages are focused on biology, but within the biology major, different kinds of health sciences programs exist. So you'll see two different choices here, health sciences or medical imaging. As Lucy had mentioned previously, we offer different concentrations within medical imaging, including things like sonography or X-ray. There also are completion programs related to medical imaging. So if you end up with a licensure through CCRI programs, you can come for a completion certificate for a couple of different concentrations here. Medical imaging, I apologize. Health sciences contains a few different kinds of concentrations and completions. So CCRI also has a dental hygiene program. There's also a respiratory therapy completion program here for RIC. So if you are licensed as a dental hygienist or respiratory therapist, you can receive your bachelor's degree through our completion program at RIC. Food safety is sleeping for now, so that one is not currently active, but human services, that Lucy mentioned in her presentation, also exists along with medical laboratory sciences. So you can find out program goals, course requirements, and such from each. And there's also some good data available for some of them. So to learn more about required courses, you can visit the college course catalog for these requirements. You can see what types of courses are required, where are your choices, what do these programs look like, and that's available from the department pages. It's not included here. I don't see it yet. Okay. Here we go. So under biology programs, in addition to the biology majors, medical imaging, health sciences, we also have pre-professional programs. These are not specific majors, but if you're interested in becoming a veterinarian, optometrist, dentist, medical professional, some doctor, PA, things like that, if some kind of med school is in your future, we have a professional preparation program for that. It's not a separate degree or a separate minor sort of thing. It's simply like an advisement track for a packet of courses that would help best prepare you for the entrance exams into those professional schools. So you'll see there's two different contacts for the pre-med stuff and the pre-vet stuff. Okay. So that was through the current students tab, academic advising, students, list of department chairs and program directors. So this is a list by school that you can access directly, contact information for department chairs if that's the first step for you. If the first step you prefer to do a little more research on your own, I would suggest visiting the Future Students tab up at the top. And you'll see there's a lot of information here about all different kinds of facets of student life at RIC. So you can learn more about how to see the campus, what's it look like, virtual tours, in-person tours if you're a Rhode Island resident. We're currently offering those, financial aid information, campus life information. But what I want to highlight, if you just want to start with the academic program research, is under academic programs, majors and programs. This is an alphabetized list, so it's all of the majors together. They are not divided by school. So I'm going to go down to healthcare administration. This is our health-focused major within our School of Business. If you click on the links of the major itself, this will take you to the department webpage. And I'm showing you how to navigate that information. To the right, these little map icons. This will open up into what we call the academic roadmap. This is an advisement guide for students to figure out what classes do I need to take. So for healthcare administration, you'll find on page 1 a checklist of courses that you need. And there are both cognates that are offered outside of healthcare administration, as well as required HCA healthcare administration courses. So you take all of these, you've completed your program requirements. Now, to receive a degree at RIC, you also need to complete your general education program and reach 120 credits minimum. So to help you figure out what that looks like, from page 2 on, we have a suggested semester by semester schedule. So you'll see recommended courses for semester 1, semester 2, 3, all the way through to a completion, degree completion. So this list, semester by semester list, includes both healthcare administration courses, program courses, as well as general education and other milestones that need to be met. If you're transferring with fewer than 24 credits, then it's pretty simple to just adopt this suggested guide. If you're coming to Rhode Island College with 60 credits, you have your degree, then the suggested timeline may not suit you, and that's okay. This timeline is simply suggested. It'll give you a solid idea of in what order to take the courses. But I think more importantly for transfer students looking at these pages, the right-hand side provides really good information about things like what are the prerequisites for these recommended courses? What milestones should I be hitting? When do I meet with my advisor? So this timeline on the right-hand side, I think, is more useful for transfers because everyone has a different path coming in. You may have completed all of your courses here, 2 courses from here, 3 classes from here. So you'll have to do a little bit of patchwork figuring out what you have left to complete. And you can do that with the help of your academic advisor, who will be a faculty member within your program. So as Lucy mentioned, you have a faculty member. Every single student at Rhode Island College has a faculty member assigned to them within their major to help them navigate through course requirements and also academics in general. Right? So that is the academic majors and programs list. It is alphabetized, links to the department, links to the academic advising guide, and it lists our different majors here. Let me just take one last tour for you. For the nursing program, I do want to highlight that we have both a bachelor's of nursing as well as an RN to BSN program. So if you receive your RN license from the CCRI program, we have essentially what's a completion program for nursing as well. So you can pursue your RN licensure through Rhode Island College or the degree completion, depending on what path you take, whether you take that nursing program at CCRI or not. And the nuances of those programs are available through the School of Nursing webpage. So you'll find information for prospective students of both sorts, the basic baccalaureate, your basic nursing degree, as well as the RN to BSN program. So you can find out the exact requirements for the School of Nursing by accessing their department webpage. It is well organized through admission requirements, what's the application look like, how do I receive my degree, frequently asked questions, including contact information. So there's some really good information at the School of Nursing. I know it's a pretty popular major for transfers, particularly those in the health pathways. So I wanted to make sure to cover that today. And that about rounds it out for me today.
Thank you so much, both Sara and Lucy, for presenting us with all of this great information about exploring RIC for transfer from CCRI. Unfortunately, we are at the end of our time today for this session, but you have information in this session that we just had, and you are welcome to access this and any other recordings of sessions on the same web pages that brought you to this session live today. And you can reach Sara and Lucy about specific transfer information, or to start that process, or to answer any questions you have about transfer through their website as well. So you can learn more about the academic and career paths at CCRI at www.ccri.edu/pathways. And I'd also just like to remind everyone to join us at the virtual job fair hosted on Handshake on Thursday, November 12th from 10 a.m. to 1 p.m. And you can find information on Handshake on the same website that you got to this live session or this recording on today. So again, thank you very much to Sara and Lucy and everyone at RIC. And I hope everyone has a great day.